Health really focuses on being able to take the help, to take the information, to take the teaching to the people. Some people are just not aware they are able to come in for these services, and that's why outreach is so important.
'Cause I just need a helping hand. It's gonna help me stand.
Ryan Health is a community health center for 55 years now, and the mission is not only to provide quality care to our patients, it's to be in the community, reaching out to make sure that the community is also receiving the care that they need.
Survival kind of looks different for different populations, so things that we might see as necessities aren't always necessities to people. So the healthcare aspect is, I'm alive, I'm here, I'm eating, I'm in shelter, so this is enough. But you don't really think about, oh, my blood pressure, or oh, my blood sugar, or oh, I have these headaches. It's just like, I'm alive and I'm here.
Our motto for Ryan Health is healthcare is a right and not a privilege. And this is really something we try to focus on and tell people, yes, you can be seen.
So there's absolutely no community health without community outreach and engagement. The first thing is to remove the barriers for folks not getting the services. A simple barrier could be a mom's working and she doesn't have the time to make the appointment to bring the child in. Why don't we take the vaccines to the school? So mom can pick up the children and get the vaccine at the same time. And then that's kind of really leveling the playing field.
When you increase access to care, people feel more at home and they feel more comfortable. People don't typically want to leave where they're at. They feel safer where they are. And when you come to them, you kind of show them a sign of respect. People are here for you and people can do something to help you out.
We are going to the people. We're not waiting for them to come to us. A lot of them are afraid. Some people don't want to hear certain things.
The school that I work in, 50% of the students live in either homeless or domestic violence shelters. They might not have established primary care homes, and they might not have even a routine pediatrician, and we're there to provide vaccines, to give them their physical, to do a primary assessment. So to be able to have access to a healthcare provider in their school is crucial.
A lot of the partnerships that we've created recently have been due to our vaccine initiative.
If anybody needs the vaccine, we're here today. We'll be here till 6 o'clock.
Us having this new program with our mobile outreach team to come out and offer these services to the community has made it easier for us to bolster our connections.
We take that opportunity to be able to also provide different information, such as checking their blood sugar, teaching them what blood pressure means. A lot of people say, I have high blood pressure. They don't really understand what that means or what it's doing to their body.
Part of community health and outreach is ensuring that folks know where the resources are. That's one of the things that Ryan is very strong with, is their partnerships with other community-based organizations, such as the faith-based institutions, such as substance use programs.
One of the ways that we work so connectedly with the community was with the vaccine rollout for the pediatric population. Getting vaccines administered to our school-age children was a huge effort, and we were able to vaccinate large amounts of children in the schools.
We have to listen to the folks that we are providing the services to. We really need to hear people where they're at and what their needs are.
We see a lot of African Muslim patients, and one thing about the African community in the mosque is they're always on the move. So what we did was we made sure to come at the time that was best for them. Friday is weekly prayer for Muslims, and I see some people from my mosque, I see some people from other mosques, and I speak the language, so people just felt comfortable. They would come and ask questions. They would just make them feel like, okay, this is one of our people coming to bring a service to us.
I was born and raised in Washington Heights, and I can see myself in the patients that I come across. I can see their struggle that made me push to be a nurse, because I'm able to see that they want to live a better life.
And I rise unafraid, I rise up, and I do it 1,008 times again.
We do community events in churches, senior centers, schools. Ryan Health will never say no to a community event. And that is our mission. We need to be in the community because there are so many people that are not receiving health care. And we are out there trying to bring them the care they need and deserve.
we really forget how hard life in general is on our youngest population. And when they come to see me for a hurt knee or a headache or stomach pain, and then I catch feelings of anxiety or depression that they don't talk through with an adult, we get to process these emotions and to be able to integrate that in their overall well-being at the age of 10, 11, 12 is huge.
My favorite part is being able to be out in the community, being able to see the possibility in everyone and be part of people doing better and people helping me and able to do good for themselves and know that they can, more importantly.
Just seeing how many people we've reached. When I sit down at one outreach event, I see, oh, we got 10, oh, we got 20, oh, we got 10. Seems like small numbers, but then you look over and you're like, how many people did we do in 6 months? And you see, oh, wow, we did 700 people. That's a lot of people. Seeing the small steps turn into like bigger steps, it makes me feel like I'm getting somewhere, I'm doing something, I'm making a dent in a growing problem.
And we'll